The first criterion for a BPD diagnosis is frantic efforts to avoid real or imagined abandonment. Note: do not include suicidal or self-mutilating behavior. People with borderline personality disorder, BPD, frequently struggle to maintain healthy relationships due to their fear of abandonment. This fear can cause a constant need for reassurance, paranoid ideation, and a drive to avoid real or imagined abandonment at all costs. These behaviors frequently backfire and cause the exact abandonment that the BPD sufferer is trying to avoid. The second criterion for a BPD diagnosis is a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. In the diagnostic criteria for borderline personality disorder, BPD, unstable relationships refers to a pattern of intense and rapidly changing interpersonal relationships characterized by alternating between extremes of idealization and devaluation, often described as splitting, where someone views others as either perfect or completely awful, with quick shifts between these perceptions. This is considered a key symptom of BPD and is often cited as criterion 2 in the DSM-5 diagnosis. The fourth criterion for a BPD diagnosis is impulsivity in at least 2 areas that are potentially self-damaging, for example, spending, sex, substance abuse, reckless driving, binge eating. Note: do not include suicidal or self-mutilating behavior. The fifth criterion for a BPD diagnosis is recurrent suicidal behavior, gestures or threats or self-mutilating behavior. APD is associated with intense negative emotional experiences. 3. These experiences are so painful that many people with BPD report wanting to escape. They may use various strategies to try to reduce their emotional pain, such as deliberate self-harm, substance use, and even suicide. The sixth criterion for a BPD diagnosis is affective instability due to a marked reactivity of mood, for example, intense episodic dysphoria, irritability, or anxiety, usually lasting a few hours and only rarely more than a few days. People with borderline personality disorder, BPD, often experience very intense mood swings. People with BPD often feel like they are on an emotional roller coaster. While it's normal to have your mood shift from feeling good to feeling down, someone with BPD may experience very extreme mood shifts for minor reasons, going from feeling okay to feeling devastated, desperate, or utterly hopeless within a matter of moments. The seventh criterion for a BPD diagnosis is chronic feelings of emptiness. The experience of emptiness is an important criterion to target in treatment because the symptom can be devastating for many individuals. For some people, emptiness might also feel like loneliness, dissatisfaction, boredom, sadness, apathy, and disconnection. Feelings of emptiness can be very distressing for a young person, acting as a barrier to self-fulfillment, a sense of purpose, and meaningful connections with others. The eighth criterion for a BPD diagnosis is inappropriate, intense anger or difficulty controlling anger. For example, frequent displays of temper, constant anger, recurrent physical fights. Borderline rage or borderline anger is more than just a standard emotional reaction. The reason anger in BPD is called inappropriate is because the level of anger seems to be more intense than is warranted by the situation or event that triggered it. A person with BPD may react to an event that may seem small or unimportant to someone else, such as a misunderstanding, with very strong and unhealthy expressions of anger, including physical violence, sarcasm, and yelling. The ninth criterion for a BPD diagnosis is a transient stress-related paranoid ideation or severe dissociative symptoms.